What is central sensitization, and how does it cause fibromyalgia pain? Imagine your nervous system as a finely tuned alarm system. In fibromyalgia, this alarm system becomes overly sensitive, reacting to things that normally wouldn't cause pain. This heightened sensitivity is what doctors call central sensitization. It involves the brain and spinal cord becoming hypersensitive, so even mild or normal sensations are perceived as painful. This is why people with fibromyalgia often experience widespread pain that seems to come from nowhere. Central sensitization happens when nerve cells in the spinal cord and brain become more excitable. Normally, when you get hurt or have inflammation, your nervous system sends signals to alert you. But in fibromyalgia, repeated or ongoing signals from nerves in the body, especially from pain fibers called C fibers, keep these central neurons in a state of heightened responsiveness. Over time, this neuroplastic change means that the nervous system starts to amplify pain signals, making them feel more intense than they should. Another piece of the puzzle is how the brain controls pain. Under normal circumstances, the brain can send signals down the spinal cord to dampen or inhibit pain. But in fibromyalgia, this natural pain control system is often impaired. Instead of calming down pain signals, it may become less effective or even promote more pain. This imbalance makes pain feel worse and more persistent. The expansion of pain-receptive fields is also part of central sensitization. It means that neurons involved in pain processing become active in response to a broader range of stimuli and across larger areas of the body. So, pain that starts in one spot can spread or become more diffuse, which is common in fibromyalgia. Neurochemical changes are also involved. Researchers have found elevated levels of certain chemicals in the cerebrospinal fluid of people with fibromyalgia, such as substance P and nerve growth factor. These substances promote pain facilitation and contribute to the ongoing pain experience. Brain imaging studies support these findings, showing increased activity and connectivity in regions associated with pain perception and emotional regulation, like the insula and anterior cingulate cortex. At the same time, areas responsible for pain inhibition show decreased function. This combination makes the brain more reactive to pain signals and less capable of calming them down. Central sensitization often begins with ongoing peripheral input, such as injury, inflammation, or other chronic pain conditions. This persistent input triggers changes in the central nervous system. Even after the initial cause resolves, the nervous system can stay in a sensitized state, maintaining widespread pain and other symptoms like fatigue, sleep problems, cognitive issues often called fibro fog, and mood disturbances. Understanding central sensitization helps explain why fibromyalgia pain is so widespread and disproportionate to any visible tissue damage. It also clarifies why treatments that target the nervous system, such as certain medications, physical therapy, and cognitive behavioral therapy, can be helpful. Managing fibromyalgia involves approaches that aim to calm down this hypersensitive nervous system, rather than just treating peripheral tissues. Since central sensitization is a complex neurophysiological process, a multidisciplinary approach tailored to each person's needs is usually most effective. Always consult healthcare professionals for personalized diagnosis and treatment options, as individual experiences with fibromyalgia can vary widely.